My name is Doug Sockman. I'm with Skylight Financial Group. Proud to be here this afternoon. We're actually one of the sponsors, along with Smart Business.
Okay.
So you'll see a few of us wandering around.
Okay.
Looking forward to hearing Tom and his message, and we thank everybody for coming.
Great. Can you tell me a little bit more about your company and how you connect to healthcare?
Actually, we're a full-service financial planning firm.
Okay. All right.
And we've partnered with Smart Business as far as working with small and medium-sized employers.
And I'm here just to really hear about what Tom Zenty has to say about healthcare in the city.
Wonderful.
Hi, Molly Niter. I work at Tri-C as well. I'm Director of Healthcare Careers Initiative, and UH is one of our partners, and we're interested in hearing what Mr. Zenty sees for the future.
That's wonderful. So you're really involved in jobs in healthcare and workforce development.
Absolutely.
Hi there, I'm Jim Talton. I'm with Synergy Marketing Research and Strategy Company, and we're just delighted to be here to support the program.
Hi, Elaine Straub with Lincoln Financial Advisors, and the reason I'm here is that the cost of health care and the health care trends are very important, and they affect people's financial future.
Name's Dan Brennan with Skylight Financial Group. We're the sponsor of the event. Generally, we're interested in the economic development of the area. Clearly, UH is making a significant contribution, well over $1 billion in development. So it's something we're interested in hearing what their next plans are and see how it fits into the overall scheme for the region.
Excellent.
This is Ken Lancy from
Hi,
Consolidated
nice to meet you.
Graphics.
Nice to meet you. And anytime Tom speaks, I like to try to come and listen. A lot of words of wisdom, and brings us up to date as to what they're thinking of doing. Kind of the cutting edge side of it.
Sure. And how do you see that impacting your business?
Well, our business, again, I have several, and as Cleveland and the county goes, our business goes. So it's really critical that we all work together for the greater good of all.
My name is Michael Foyer, and I'm CEO and founder of Max Wellness, a new retail concept for health and wellness.
Yes.
And also a columnist for 8 years with Smart Business.
Okay.
And author of a new book, The Benevolent Dictator.
Welcome to everyone. This is a record crowd for one of our Smart Business Luncheons, so we are very, very excited about that.
It's my pleasure today to introduce our speaker, Thomas Zenty, Chief Executive Officer of University Hospitals.
We've now spent about $140 million on the creation of an integrated electronic health record. And it sounds rather simple to have one patient and one record, but it costs us about $140 million today to get there. But it's critically important because although we can talk about buildings and programs and services, what really leads all of this together is information technology and our ability to have one patient, one record. If our goal is to keep the youth in Ohio, I think we can do a much better job, quite frankly, focusing on what various industries' needs are going to be, both today, 3, 5, 10, even 15 years from now. And let's begin to true up the educational programs that we're offering in both the community college level, at the undergraduate level, at the graduate level. And I know in healthcare alone, there are a tremendous number of opportunities where we know we're going to need particular types of people who are not available today. So I've actually talked to the governor about this as a topic of interest for us, but not just about healthcare. We should be doing this in every industry now at this time. It should be in manufacturing, it could be in business, it can be in advertising. Hospitals will now be paid less on the basis of volume and more on the basis of value. So, for example, we're about to move into something called value-based purchasing. And what that means is that 70% of our payment to Medicare patients will be based on clinical outcomes and particular diagnoses. If hospitals don't meet those particular baseline or threshold levels, they will see a significant reduction in payment for the services that are being provided. And about 30% of that payment will be on the basis of the patient experience. So did you communicate well with your physicians? Did you communicate well with your nurses? Was the room clean? Did you get the kinds of services that you were expecting? And if hospitals don't meet certain threshold guidelines in that particular category, there's a reduction or diminution in payment as well. Frankly, I think it's all quite good.
I think as individuals we need to live healthier lifestyles, eat healthier, exercise regularly, and take it upon ourselves to help resolve some of the healthcare issues that plague our community.
Thank you very much. That's very good advice
Pleasure
for
to
all
be
of
here.
us.